follow sound, the scene is safe. I'm a ski patrol. May I help you?
Very
Yes.
good. Hello, Cami. Okay. First, we're going to start with an NPA. Can you point to an NPA, please? Thank you. And I just grab it and show me how to size and insert.
The first thing, we're gonna measure it from the nostril.
Sorry, just to show the
Oh,
camera.
wait, I'll just do it there. The earlobe to the nostril. Go.
Very good.
And you're gonna loop it.
Which way will you point it?
Keep that
The
angled
whole-
part to the inside.
To the inside of the nose. Very good. Just slide it in. While you're doing that, what person do you put an NPA on?
You can put it on anyone.
Anyone? Do they have a gag reflex or no gag reflex?
Well, it shouldn't affect that.
Exactly. Okay. Good job. Now, how do you take it out? Just slide it right out. Okay, very good. Now, next is an OPA. Can you point to that? Very good. Grab them and then choose the one that you think is the proper size.
Okay, to measure, you gotta go from like the jaw to the mouth. So very big. That's kind of big.
Okay. So this guy really has his mouth open, but let's say it was closed. How would you open it?
To the very
Cross finger technique. Very good.
side.
Point it up, twist to the side as you push down, then you push down, and it should sit right on top of the teeth. Very good. And what person do you put an OPA in?
Unconscious, no gag reflex.
Very good. And how do you know if they have a gag reflex?
They start gagging.
Yeah, when you put an OPA in, if they start gagging, take it out. They have a gag reflex. And go to the NPA, and then just take it out. Yeah. Very good. Okay. Now, can you point to a suction device? Very good. Now, show me how to use it.
Okay, so on like the machine, you're supposed to measure from like here to here. So you don't want to go down like further than that.
Oh, yeah.
So if there's something, you'd use gravity, so you tilt them, or you could sweep if you see it and think you can get it. If not, use
Okay.
this, and you go in, and then squeeze and do circular motions as you go up,
Mm-hmm.
and tilt it, and
Away. Yeah, you point it up and let go and away. An adult, how long do you suction for?
no longer than 15 seconds.
Very good. On a child, how long do you suction for?
10 seconds.
And then an infant?
5.
Very good. Okay. Last thing, point to a BVM and show me how to use it.
First, you got to open it.
So on the test, the instructor will be your help in this, and you need to ask for help because that's something that they might check, that you ask for help. So show me how to use it. I am your help if you need help.
Okay, so I'm just gonna put it on, and then I'm gonna have you help me and keep it secure.
Okay.
So make sure it sits. This guy has his mouth open, but it's like under
He's
the
really
lip
big.
and the top. So you're gonna hold that
How am I gonna hold it?
securely with the
C shape. Okay. Going back.
and we're gonna slowly squeeze.
Mm-hmm.
Breathing is boring.
Yep. How long? So, how do you know how far down to press?
When you see their chest rise.
Exactly. And for an adult, about how much do you? What's the breathing rate? Like how many breaths you're gonna give them per minute?
Around 5, because they breathe at 12 to 20 breaths per minute.
So yeah, 12 to 20 breaths per minute, and then about 1 breath per 5 seconds, right?
Mhm.
Yeah. Very good. There we go. Okay, scene is safe. I have my gloves on. I asked for permission. Hi, Mama Kuchel, can I help you? Yes. Okay. Cylinder's on its side. You always place it on its side. First, you check that the cylinder is okay. There's no rust or cracks. It looks good. You can now put it up. First, you're going to check if there's any air in it by just letting a little gas out. Lefty, loosey, righty, tighty. There's some air. You hear that? Okay. Now we're putting this on. There's two little knobs right here, which are going to go in the little hole right here. Put that on. And then you tighten it, righty-tighty. Just finger tight, actually. I know. Yeah, just finger tight. I put it on too tight all the time. I'm going to point this away from me because when you turn it on, it might burst and hit you, but I think that's fine. Yeah. Turn it on, lefty-loosey. Just spin it, just do one whole thing. I'm not sure how many holes. So now you see on here that it says full, or at least it's above the red, so it's full. Now, they might ask you, okay, point to a non-rebreather mask. This is a non-rebreather mask. You're going to put this on here, just clip it on, and then you're going to turn it on. They're going to ask, at what flow do you put a BVM? 15 LPM. So 15. So here, you can put your finger on top to let this inflate before you put it on the person. Then you put it over, blah, blah, blah. Okay, now you can turn it off. So that's a non-rebreather mask because they're not breathing the same air. You can take that off, and then they're gonna ask about nasal cannula. This is nasal cannula. You're gonna put this on also. And then they might ask, how do you put this on a person? So this goes in their nose, under their chin, and behind the ears. And you can make this go tighter. Well, it's not their chin. And that is how you put that on. And then they're gonna ask, what flow do you put a nasal cannula on? And it's 2 to 6. So I'm gonna put 6. There we go. That's how you put a nasal cannula on. I'm gonna turn it off. Take it off. Take the thing off. So now we're finished using it. I make sure that this is at 0, and then I tighten it all the way back. Tighten till you can't pull anymore, but finger tight. And then you're gonna let out all the. I let out all the air because there's still some in here after I closed the tank. And now that all the air is out, put it back to 0 again. And then you see on the tank that it says empty. And then you just lefty-loosey, take it off. And then you place it on its side. Always place it on its side. That's how you do the tank.
OEC skill 21-6 helmet removal. Okay. Seat is safe. Got gloves on. Hi, we're with Keep Chill. Maybe help you.
Yes, please.
All right. I'll hold the head and then. Secure? Yep. Okay. Nice. Ready? Yep. You want to make sure the head doesn't fall back when you.
Mm-hmm.
Now, can you feel the spine? Just to determine there's nothing wrong with it before I let go.
Mm-hmm.
She's okay. Okay.
And what was the reason you took off my helmet?
Because there was a crack in it.
Very good. Oh,
Crack.
there was a, okay. Crack. Knuckles.
OEC ski boot removal. Hi, I'm from Ski Patrol. Can I help you?
Yes, please.
Okay, I have my gloves on. Can you stabilize the leg?
Mm-hmm.
I'm going to make sure the leg is stabilized before I start taking off the boot because we don't know what the injury is yet. I'm be extra careful. Everything probably really hurts. I'm not gonna let these fall down on you. Okay, I'm gonna open this up. You can try to put your hands as far down there as you can. Okay, are you good? Okay. Emily, do you think you can point your toe?
Mm-hmm.
You got it?
Mhm.
Okay. Making sure it doesn't drop. Now the split is behind me. Oh, okay. Do you feel that?
Careful. Wait. Yes, I can feel that. I don't know.
Can you wiggle your toes?
The injury is like right here, so just for the camera, just don't press on top of the injury. That's good. We already took off the other boot to see how you take it off. This is the injured foot.
Now, you can tell me when to lift. I mean, you can tell me when I should size under. How do you lift?
Lift on 3. 1, 2, 3.
Sorry.
Nice.
Okay, now you ready to drop it?
Dropping.
You're right.
Oh, that's cold.
Yeah, it is cool. So this splint is just like the other ones. It just goes in the middle and you hold it up like that. So just pinch it up. Nice. And then hold on. Yeah, there we go.
I'm adding if you want to.
Let's see how it fits in this side. Feel secure?
I do feel secure.
And I'm gonna undo this one and I'll twist it.
Okay.
Now I'm gonna check CMS. Can you feel that?
Yes.
Can you move your toes?
Yes. Yeah, and you try, but yeah, you try.
You're great.
Good job. Splinting.